We're coming to you today with a new tool that we want to use to improve our communication to you, to help get information out a little faster and more efficiently, hopefully, to all of our residents and our family members, as well as the Friends of Good Samaritan. We have really been in unprecedented times, and we just wanted to update you on what we're doing here at the Village as we seek to serve people through this time of the global pandemic. First of all, just a little bit about our support systems during this time. Many of you are aware that 15 months ago, the Good Samaritan Society joined with Sanford Health, which is a large healthcare system based in Sioux Falls, South Dakota. At that time, our motto was "Stronger Together." And today, that motto is more fitting than ever before. We are so grateful to have the support systems of Good Samaritan and Sanford Health to help us as we navigate new waters, as we develop new policies and procedures here at our village, all with the goal of keeping our residents and our staff safe. And it has been a wonderful experience so far. Of course, we're always using the guidance of the Centers for Disease Control, the CDC, in all that we do here, in all of our new plans and our new programs. But our goal ultimately is always to continue to serve your loved ones to the best of our ability, always with our Good Samaritan mission to share God's love through the work of health, healing, and comfort. Today I have three of our leaders with me who are going to share just a little bit from their area of expertise in what's happening in their area. So first, I'd like to call on Julie Marco, our Healthcare Center Administrator.
Hi, I'm Julie Marco, the Healthcare Center Administrator at Good Samaritan Loveland. Thank you for the pleasure and honor of caring for your loved one. We're doing our best to keep them safe and our employees safe during this very challenging time. We, as you are aware, are under great demands and restrictions by the Department of Health and by our own infection prevention policies. We have an infection preventionist on staff who has been working more than full-time trying to keep everyone safe and everyone with the most protection possible. We have a strong director of nursing and housekeeping team to keep our environment as safe as possible as well. Just yesterday, we had a Department of Health team in to do a visit and to inspect our procedures and our policies on infection prevention. And if we are successful in that, it was a very good review, and they were very impressed with what's in place and our efforts in training. And that training and those procedures are just tighter every day and more in depth every day. So wanted to share that with you. We are working hard at meeting the residents' social needs, even though they are confined to their rooms for the most part. And our activity department is working hard at being creative on how to keep them stimulated and engaged while still keeping them isolated and safe. As we're taping this, we do not have any positive cases in our building, and that's a blessing each day. So we are striving hard to keep that in place. We do encourage families to contact us to set up and schedule FaceTime visits with their loved one to keep that communication open, and invite you to call the facility and ask for activities, or myself, Julie Marco, and we'll be glad to get that set up. We look forward to having more updates for you later in the week.
Hello, my name is Melissa Reel. I'm the Director of Assisted Living here on campus. Many of you I haven't met face-to-face, but so this is our first time meeting, and I look forward to the day that we can get together and meet and just touch base. But for now, we'll use this tool to communicate. We in assisted living are emulating what healthcare is doing, so many and all of our precautions are the same as healthcare. The QMAPs and the universal workers, along with the nurse Carrie Schlager. We are all doing our best to protect the residents and keep them safe and healthy. We have started wearing masks, and I have one here with me. We are wearing our masks when we're around residents. Some of the fun things that we're doing on assisted living, because we're trying to keep everybody happy too. We are allowing walks in the hallways, and that's one individual at a time. So there's some coordinating and scheduling that we do with that. Deb Pullen is a big asset in coordinating that for us. We're going to start later in the week doing some hallway exercise classes, and we are just skipping every other room and allowing the residents to step in their doorway and follow with the wellness group to do an exercise class. And then after the 30-minute program, we switch and the next rooms can go. And the other thing that has been really successful is hallway bingo. Who would have thought we are becoming very creative in our activities? I just wish all of you the best. Please contact us if you need anything. We also have the capabilities of doing the FaceTime iPad meetups. We just need to schedule and coordinate a time. And like I said, if you need anything, let us know. If you need to drop something off to your loved one, that is available through the healthcare entrance, and that's the blue awning entrance. So you can bring it there to the screening desk, and then one of the staff members will make sure that your family member gets that. My phone number is 970-624-5420 for assisted living questions. Have a great day.
Friends, I sure do miss you. Our hallways are just so vacant, and I miss all of your smiling faces. But the senior living team is staying very busy. We are helping dining services with meal delivery, and if you want a meal delivered to you, we're doing it at no charge right now, so please don't hesitate to call and order a meal. We're also delivering all of the mail inside the apartment buildings, and it gives us a great opportunity to see each of your faces one-on-one, just to touch base and make sure you're all staying well. Nate is actually getting ready to do a telehealth doctor's visit with one of our residents this afternoon. We do have an iPad in our offices, and if you need a doctor's visit and you want to do it with telehealth, we'd be happy to help you with that. In the meantime, stay safe. We love and miss each and every one of you.